Hello friends, folks, and viewers. My name is Charles here at Nutrition 101. Here back to give another lesson on a uncomfortable and awkward topic. All right, but before you do that, don't forget to subscribe to this channel if you like the information that you see here, and of course share the information. All right, so let's get right to it. We're going to talk about something called anal fissures, right? It's very awkward to even just talk about, just to even say, to even think about. But if you had one or know anyone who has one, you know the nightmare that it could really be. And of course, you're asking to yourself, why is this related to nutrition? And I will get into that in a moment. Let's just talk about what an anal fissure is, okay? It's a tear in the anus, or like the lower rectum area, like your anal canal. So basically when you're having bowel movements, right, this little tear is it's gonna feel that every single time, and you're gonna feel that every time. We're gonna get into the symptoms in just a moment, right? It's also called an anal ulcer, right? So different names for it, but the common name is anal fissure. It's a very uncomfortable ailment to have. Okay. So what causes it? Constipation, hard or large stools, right? Those are your common things because it stretches out the anus a bit too much, or you're pushing too hard, and that could create a tear. All right, chronic diarrhea, anal sex can do it, and of course a bad diet. And I'll tell you what that means in just a moment. All right, so symptoms. What happens when it's symptoms, right? It was bleeding first, so bleeding in your stools. It's going to be blood in the water. You're going to see, it's very scary because you just see blood just dripping from you, and the water is red, your stools are red. You're like, what's going on? Of course, burning sensation while you go into the bathroom, and painful bowel movements. And what I mean by that is, I actually had one back in 2009, 2010. And when you go, it feels like literally there are spikes facing the opposite way. So going to the bathroom was a dreadful thing to even think about. It was horrible, and it was something I just did not want to do. And so I would eat less, and because I didn't want to go to the bathroom, and I was losing weight. So all these things, and that creates anxiety, right? It's another thing, right? So that's where anxiety comes in, because you're nervous to go to the bathroom because you're bracing onto the sink or whatever you can get your hands onto, just going to the bathroom. And so it's a miserable experience. I don't wish it on anybody. And if you've had it before, I'm here for you. All right. And of course, swollenness, it's swelling, right? It's the area gets very swollen after that experience, which could take a long time because you're trying to not really let it go out, and you're trying to hold on to it, but you got to get it out. So it's a painful experience. The pain could last for also like a couple of minutes afterwards. What can we do about that? There are certain treatments we can do to try to fix these things. What's recommended, at least in the medical industry, right? We have creams, surgeries, sphincterotomy, right? Where they want to remove the sphincter, so that muscle control that pushes the bowel movements, that pushes the stools out, right? They want to take that away. They want to take that away from you, which is ridiculous, right? Surgery is not an option. Never go that way. Of course, there's suppositories, which are these little inserts that you can stick up there in your anus, and that's supposed to like kind of soften things up with your stool to just make it easier to go out and lubricate it, right? Then of course you have warm baths where you just sit, like you can get like a little foot bucket or foot spa thing. You just sit in there and try to like soften up that area 3 times a day, right? So just make sure it never gets dry. And another thing, when it comes to these treatments, who wants to do these things? Who wants to put suppositories in themselves, a couple of days a week, and it start leaking and melting and things like that? It's horrible, right? Surgery, no brainer. Nobody wants that, right? That's who wants to get cut open. Creams, that's stuff that they use. These are chemicals, right? These are chemicals you're literally putting in an area in your body which it can easily get absorbed. And of course, what's in these creams, these are like cancer-causing, chemicals, right? Like any other cream, or antibiotic creams or steroid creams or anything like that, right? That stuff's going to create damage. And irreversible damage at sometimes, right? Creams also thin out your skin, right? I used to use so much creams, and putting it on my psoriasis that this one finger I didn't wash enough, and now the skin is so thin on this finger that anytime the winter comes, it just cracks and it gets bleeds, and I can't stop it. And it's, you know, again, that's just damage that I can't fix. So you just want to avoid that and try to just keep your body overall healthy, and your body will thank you. And of course, you have nutrition. That's where I come in. So your nutrition plays a big role. Why does it do that? Well, I'll tell you one thing. In 2009 and 2010, when my psoriasis was at its worst, that's also when my anal fissure was at its worst. It's when I had it, right? And I never knew those two were linked together because it was never told to me. There's no one place that's going to tell you. There's no one platform, no doctor is going to tell you all these symptoms that are going to lead to this, right? And there's no one place that tells you how to fix all these things, especially through nutrition. So when I fixed my nutrition and got it right, fixed my immune system, right? Once my immune system healed, my psoriasis went away. Once my psoriasis went away, guess what else went away? Chapped lips, dry scalp, dry ears, dry fingernails, dry skin, dermatitis, right? That's called eczema, right? That's dermatitis is basically another name for eczema. And what are the characteristics of things like eczema or psoriasis, right? It's dryness, chapped, splitting, right? And that pretty much describes, you know, what an anal fissure could be, right? It gets dry down there, it splits, it cracks, it's painful. I get those on my fingers, right? So it only makes sense that when those things go away on the rest of your body, it's going to go away down there. It's all relevant. I mean, again, it gets on my fingers, I get on my face, eczema, dry skin, chronic dry eyes, right? I don't have to take eye drops anymore. These are all relevant. Once I fixed my psoriasis, all those things went away. My anal fissure went away, right? So it's just pretty amazing that it all happened. Again, this is just me. This may be my results, but I'm pretty certain that if anyone realized that they could just change their diet and get nutrition on point, and I'm going to leave a link to those videos, that video below where I talk about psoriasis, one of my earlier videos, you'll see that things will change and you will not have to have surgery. So please, if you're considering surgery, reconsider, because you don't have to do this. Try this first. It will take a few weeks. Regardless, all treatments should usually take a few weeks, but nutrition and healing gut and getting your immune system back up to par generally takes a few weeks for everything to start to take an effect. And every time I have like a little psoriasis, a little breakout, if I eat something like I might react to now, which is milk causes it, or certain kinds of gluten will do it, it will take a few weeks to go away. So I don't get the anal fissures anymore because I'm very conscious about that, but I'm just letting you know it makes a big deal, big difference. You know, probiotics, good oils, good fats, low sugar. You find your triggers. You do the elimination diet, where you get all your full allergens, all the high allergy foods, which is peanuts and soy and milk and dairy, and of course gluten. And then you eliminate those, and then you bring them back one week at a time, 1 week at a time, and you'll see which one of those you react to. You'll feel it. You'll feel it because you'll itch, or you'll know it. You know your body's gonna tell you something right away. So when you feel that, that's a symptom. Your body's reacting. Anything that's on the skin is a reaction to what's going on the inside. All right, that's all it is. It's just an allergic reaction. Skin issues are allergic reactions to something that's happening on the inside. So keep that in mind. Keep that in mind. Think about that for a moment, and it makes perfect sense. You get rid of one ailment, they will all go away. I promise that. And you know, if not, just let me know. If you try it out, let me know the results. Let me know what happens. Give this a try. Check out my other videos on the skin and on psoriasis, and of course, get back to me. And if you're just wondering what kind of supplements to take, but again, it's in a video I've made prior to this. You do the apple cider vinegar. You do a good probiotic, right? You consume more coconut oil, more omega-3, more fish oils, fatty fish oils, more nuts and seeds, way less sugar, right? These are the things that are going to make your body heal, right? Obviously, intermittent fasting, keto should heal any dry skin issues or dermatitis and things like that. So if you have any questions about that, of course, let me know and I can give you some more nutrition tips. But again, this is all in another video I made prior to this. All right, thank you again for tuning in. My name is Charles here at Nutrition 101, talking about anal fissures, very awkward, uncomfortable topic, but it's good that you know that you have an option that's non-surgical. All right, thank you again. Don't forget to share this information and of course subscribe. Talk to you again soon.